this evening we are going to talk about the examination of the cranial nerves.
Cranial nerves.
I don't know if you've heard of the cranial nerves before. None of you have heard about the cranial nerves. Hey. In anatomy, it wasn't mentioned.
It was.
So we are going to talk about the cranial nerves. Each cranial nerve has a way that you test for it. So that's what we are going to go through as part of the method. So there are 12 cranial nerves, and some of them are named according to their function, some according to their, and some according to a few other peculiar characteristics. So those that are named according to their function are the following: the olfactory nerve, which helps with smell, and then optic nerve, which helps with vision, oculomotor nerve, which is for eye movement. So oculo is eye and the motor is movement. So the oculomotor nerve is responsible for that. Then we have the abducens nerve, which helps with abduction of the eye. And the muscles of the facial nerve, which helps with, which supplies the muscles of facial expression. So that's what helps you to frown, to smile. Anything that involves movement of the muscles around the face is done by the facial nerve. Then the vestibulocochlear or statoacoustic nerve is responsible for hearing and balance. So these nerves are named according to their function. Then we also have other nerves which are named according to their relationship to neighboring structures or various other reasons. So for example, the trochlear nerve, it goes over a trochlea or a pulley in its course. Then we also have the trigeminal nerve, which has 3 branches. So the tri means 3 parts. So that's a trigeminal nerve. Then we also have other cranial nerves which are named according to their extent of distribution. So the vagus nerve is named after vagabond or wanderer. That means somebody who goes all over the place. And if you look at the extent of distribution of the vagus nerve, it is very, very extensive. Then you can also have the sorry, let me just. Okay, so we also have names according to the location. So hypoglossal, meaning it's under the tongue. Glossal is the tongue. So when you look at the base of the cranial cavity, of the base of the cranium, that is, if you slice or if you take a section through the skull, this is what you see. The various cranial nerves emerge from various points in the skull to innervate the base of the skull, and then the skull itself, and then other parts of the body. So from anterior to posterior, this is how it looks. So you have the optic nerve, oculomotor, trochlea. They all come out from various points from the base of the skull. Okay. So let's look at them one by one. So the olfactory nerve is responsible for smell, and it pierces the cribriform plates of the ethmoid bone, which is in the skull. Okay, and then it helps, and then it comes to pass around the nose, and it helps with the sense of smell. Now, what it does is, so what it usually does is that it helps us to be able to smell it, or there's a dysfunction. Then what will happen is that the person will not be able to smell. Typically, the commonest cause of loss of function is a common cold. And recently with COVID, that's also one of the signs of having COVID infection and loss of sense of smell. So now we go to the testing. So basically the discussion will follow this pattern. We'll talk about what the nerve does. We'll talk about how to test for it. And then we'll talk about some of the things that cause a dysfunction. Okay, so when you want to test for the olfactory nerve, you just bring items whose smell are commonly known, and then you test them one by one, and you ask the patient to occlude one nostril at a time, and then you bring the item. Of course, the patient should have the eyes closed. Okay, so we go to the optic nerve. Optic nerve deals with vision, and it also controls pupillary light reflex. What this means is that if we bring a pen torch and we shine it on the patient's eye and the pupils constrict or they dilate, that reaction is caused by the optic nerve. So if the vision is intact and the pupils react normally, it means the optic nerve is working well. So how do we test the optic nerve? There are 4 things that we do to test the optic nerve. We can test visual acuity with a Snelling's chart. So the patient sits at a certain distance from the wall with alphabets in different sizes arranged. Then we ask the patient to read, covering one eye and reading with one eye at a time. So depending on the level at which the patient can read, we would gauge the person's visual acuity. Then we also have visual field testing. Visual field is testing the extent to which your eyes can visualize objects. So, for example, sometimes when you are sitting or standing and looking right ahead of you, you realize that you can still see things to your left and to your right, even though your eyes are looking forward. That area of your vision is called your visual field. And so optic nerve, testing the optic nerve, we also test the visual field. Then we also test color vision. So the ability of the patient to see and differentiate colors is also a function of the optic nerve. And then the last thing is fundoscopy, looking at the fundus of the retina and seeing whether everything is all right. Okay. So these are the 4 ways of testing the optic nerve. And lesions of the optic nerve or problems or pathology of the optic nerve would lead to blindness and pupillary abnormalities. So meaning that if you bring a pen torch and you shine it on the patient's eye, patients may not be able to appreciate, may not be able to dilate or constrict the pupil. Okay, so there will be no response. Then patients will not be able to see. So if there's a problem with the optic nerve, that's what happens. So we look at the muscles of eye movement. And these are by the trochlear nerve, the oculomotor nerve, and the abducens nerve. So we have lateral rectus, which helps the eye to look laterally or sideways. Let's say sideways, yes. Then we have the medial rectus, which helps the eye to look medially or towards the nose. Okay. Then the superior rectus helps the eye to look upwards. The inferior rectus muscle helps the eye to look downwards. Okay. Then we have the oblique muscles, the inferior oblique and the superior oblique. The inferior oblique, so the oblique muscles help the eye to look diagonally. So inferior oblique helps the eye to look downwards and outwards. So that is looking laterally and downwards at the same time. Then superior oblique helps the eye to look upwards and outwards, so diagonally as well. So the oculomotor nerve is a third cranial nerve. What does it do? It supplies innervation to the pupillary constrictors to a muscle called levator palpebrae superioris. That is the muscle that helps to elevate the eyelid. Okay. Then it also supplies the superior, inferior, and medial rectus muscle. And then it supplies the inferior oblique muscle. So we have a formula that we use to remember the muscles supplied by the third cranial nerve. And that formula is LR6SO4. So LR stands for lateral rectus 6. So lateral rectus is supplied by the sixth cranial nerve. SO4 is superior oblique, supplied by the fourth cranial nerve. So all other muscles of the eye are supplied by the oculomotor nerve. Okay. Now, if you have a problem or a lesion of the oculomotor nerve, what will happen is that you will not be able to raise your eyelid. So you have paralysis of the upper eyelid. And then you also be unable to look down and out. And then you'd realize that in most of the cases, the patient complains of double vision. So they see things two. Okay. If you have paralysis of the two oculomotor nerves, then it means there will be bilateral ptosis. Ptosis means inability to raise the eyelid. So it will be two. But if it's only one, then it is that particular side that is affected that will have the problems. Okay. So some of these things can occur in diabetes mellitus, brain lesions, and vasculitis. That is inflammation of the blood vessels. Okay. So we move to the fourth cranial nerve, which is the trochlear nerve. And this is located in the midbrain. And like we said, SO4, so it supplies the superior oblique muscle. So if there's a problem with this muscle, what will happen is that when the patient attempts to look left, they will have double vision. And then they would also have the eyes turned outwards and to the right. Then the next nerve is a trigeminal nerve. So this, like the name suggests, it has 3 branches. If you look at the picture of the face, you can see ophthalmic, maxillary, and mandibular. So all these 3 branches make up the trigeminal. And the trigeminal nerve supplies a part of the face that is indicated in the diagram. So it supplies the upper part of the face, the cheek region of the face, and then the jaw region of the face from its different branches. So if you have paralysis of the first division, it means that when you touch the patient along the forehead, the patient will not feel anything. If you have paralysis of the second division of it, it means that if you stroke the patient around the cheek, patient will not feel that, of course, with the eyes closed. And then if there's a problem with the V3 or the third branch, you would have inability to sense anything along the jaw region. In addition to supplying the skin of the face, they also supply the muscles of mastication. Mastication means chewing. So they supply the muscles that help you to chew. So if you have a problem with one nerve, it means that there'll be weakness on that side of your jaw and you'll not be able to chew on that side. And so if a patient attempts to open the mouth, you'd also realize that the mouth will be deviated to the opposite side. So let me explain why the jaw will be deviated to the opposite side. You see that the muscle on the normal side is stronger, but there will be paralysis of the muscle on the weaker side. So once the patient opens the mouth will be pulled to the stronger side because there's a weak muscle on the other side. So it cannot counteract the strong muscle. So it will pull it to the other side. It's similar to if you have a tug of war. Whoever is stronger will pull the rope to their side. So in the same way, if you have 2 muscles, one is supplied by a normal trigeminal nerve and the other side, there's a problem with the trigeminal nerve. It means when the patient opens the mouth, instead of there being a balance in the forces on the mouth, there will be a stronger force on the side with the normal nerve. And so the patient's jaw will be deviated to the normal side, even though the problem is on the other side. I hope that is understandable. Anyway, when it's time for questions, I'm sure I'll clarify if there are any things. Then the abducens nerve is a sixth cranial nerve. From the formula SO4LR6, it supplies the lateral rectus muscle, and this helps with abduction of the eye. What does abduction mean? Abduction is bringing towards the middle. Abduction is moving away. That is abduction. And that tells you that your abducens nerve is normal, is working well. If your abducens nerve is not working well, your eye will not be able to look out. Okay. So the next cranial nerve is the facial nerve. This facial nerve supplies a lot of things. It is a purely motor nerve. If we say a nerve is motor, it means that it supplies muscles and helps with movement. So let me show you the cause of the facial nerve. So the facial nerve supplies the muscles of facial expression. It supplies the salivary glands. It supplies the lacrimal glands. That's the glands that help us to produce tears when you cry. It supplies a muscle in the ear called the stapedius muscle, so it helps with hearing. It also supplies the anterior 2/3 of the tongue and helps us with taste. So all these are functions of the facial nerve. So if there's a paralysis of the facial nerve, what will happen? There'll be facial paralysis. And here too, when the patient smiles, I'm sure you've seen a patient with stroke who smiles and the smile is drawn to one side. Okay. So what happens? When the patient smiles, the smile goes to the side opposite where the problem is. And it's on the same basis like I just explained the trigeminal nerve. If the patient, the muscles around the mouth, there's a weakness on one, and then the other muscle is intact, what will happen is that when the patient smiles, instead of the two muscles acting to keep the smile, one is weaker, and so the stronger one will pull the mouth or the smile towards itself. So the patient will smile, and you see that the weakness is on the opposite side to where the mouth goes to. And so if a patient has a stroke, for example, and the stroke is on the left side, and the stroke on the left side has affected the left facial nerve, when the patient smiles, the face or the corner of the mouth will move to the right. That's the opposite side of where the smile is. And you'd realize that there'll be dry mouth, there might be hearing loss, the tears will be impaired. Patients will cry, but there will be no tears on that side. Okay. So this is what I was talking about. And when the patient smiles, we have something we call the nasolabial fold. That is a fold between the nose and the mouth. That fold too will be decreased on the abnormal side. So there will be loss of the nasolabial fold and the mouth will deviate to the normal side. Okay. So if you have a problem of the facial nerve, what happens? You can have facial paralysis with hearing loss. If it affects the muscle in the inner ear called the stapedius muscle, then you can have facial motor weakness. So you'll not be able to wrinkle your forehead. You can't blow out your cheeks. You can't lift your eyebrows. You can't smile. You can't show your teeth. There'll be loss of taste in the anterior 2/3 of the tongue, because the facial nerve supplies the taste there too. Then there'll be loss of tearing, because I said that the facial nerve supplies the lacrimal gland. Then there'll be pain in the face. Oh, her potty is not here. Did she tell you she wants to poo? I don't think so. Why are you chasing her? Huh? They are disturbing me. Go away. Okay. So the next cranial nerve is the 8th cranial nerve. That's the vestibulocochlear nerve. And the vestibulocochlear nerve is responsible for hearing. So hearing and balance. So if there's a problem with the vestibulocochlear nerve, then you would have hearing loss. And let's just talk briefly about hearing loss. Oh, Akosia. Sorry about that. So the vestibulocochlear nerve is responsible for hearing and vestibular function. That is balance. So that's both for hearing and balance. Sorry. So hearing loss can be conductive or sensorineural. If it's conductive, it means that there's a physical blockade of the sound waves. So for example, if you have impacted ears and impacted wax in the ears, you can have conductive hearing loss. Then sensorineural hearing loss means that there's a problem with the nerves that sense hearing. So if there's a problem with the vestibulocochlear nerve, you have a problem with hearing, and that type of hearing loss will be sensorineural. So when you want to test hearing function, we have a test called the Weber test, where you strike a tuning fork and place it in the midline, and then you tell the patient to tell you where they hear the vibration. So normally, if a patient is listening, they will hear the vibration equally if both nerves are working well. If there's sensorineural hearing loss, what will happen is that there will be lateralization to the normal ear, meaning the patient will hear the normal sound in the normal ear, and the other ear, they won't hear very well. Okay. The next nerve is a glossopharyngeal nerve. That's the 9th cranial nerve. And it supplies. Hey, what are you chewing? Come. Please excuse me. Yeah. Oh.
Akosia, they worry, madam.
Promise Akosia, you buy a chocolate. Stop.
I'm back. Sorry.
Okay. Thank you, madam.
Right. So
Akosia, open your mouth.
I took it out of her mouth. You always have to wash them before they end up. Oh God. So the glossopharyngeal nerve is responsible for supplying sensory innervation to the posterior 1/3 of the tongue and then the pharynx. You remember that I said the facial nerve supplies taste to the anterior 2/3. So the other 1/3 is supplied by the glossopharyngeal nerve. Okay, and the glossopharyngeal nerve also supplies the muscles of the pharynx. And so we test it by doing the gag reflex. If your gag reflex is working well, if you attempt brushing your teeth or bringing a spatula to the very back of the tongue, of the throat, what will happen is that the muscles will contract and then you gag. So that is a test of the function of the glossopharyngeal nerve. Once it's working well, yeah, okay. Then the vagus nerve is a very long nerve. If you were here at the beginning, I said that it's named after a vagabond, meaning that it's a wanderer. So it supplies a lot of muscles. The pharyngeal muscles, the larynx, the ear, the auditory canal, parts of the tympanic membrane, the posterior fossa of the brain, the trachea, the bronchi, the esophagus, the gastrointestinal tract, up to the junction of the middle and distal third of the colon. So if you look at where the vagus nerve starts from the throat, It comes to the esophagus, the trachea, the bronchi, all the way to the junction between the middle and distal third of the colon. You see that it's a very long nerve, and that's why it's named after vagabond or wanderer. So we test the vagus nerve also by checking the muscles of the throat. So if you put a spatula in and the patient tries to vomit, it means that vagus nerve is intact. Okay, so this is how we test the vagus nerve. Okay, the other thing is also that there's something called the uvula. When the patient opens the mouth and says, ah, if you look inside the mouth, you see that there's a central structure. This is better demonstrated practically. Okay, so when a patient says, ah, and you see the uvula, when you touch the uvula, you realize that the uvula will deviate to the normal side because the muscles on the weakened side are weak. So the uvula is similar to what we were saying about the trigeminal. And so the uvula will deviate to the normal side. Okay. The spinal accessory nerve, that is the 11th cranial nerve, and it supplies the muscles of the back, the shoulder, the sternocleidomastoid muscle. So the muscle on the neck, when you turn your head to one side, you see some bulking up on that side of your neck. That muscle is called the sternocleidomastoid muscle. Also, when you try to shrug your shoulders, there's the muscle that helps you to shrug your shoulders. It's also supplied by the spinal or accessory muscle. Okay. So if there's a problem with the spinal or accessory muscle, what will happen? It means that when the patient tries to turn the head, you will not see that bulking of the muscle. So that side is weak. Then also there'll be weakness when the patient tries to shrug the shoulders. So you realize that on that side where the spinal nerve is problematic, patients will not be able to shrug the muscle because of the weakness of the trapezius muscle. Okay, so how do you test the spinal? You put both hands on the patient from the back, and then then you ask the patient to shrug. If the patient is unable to shrug on one side, and it tells you, oh, then it tells you there's weakness on that side. Then also there's sternocleidomastoid muscle. If you ask the patient to push against your hand, and the patient is not able to push against your hand, it tells you there's a weakness of the sternocleidomastoid muscle on that side. Okay. Then the last cranial nerve is the hypoglossal nerve. This is a 12th cranial nerve, and it supplies the muscles of the tongue. Okay, so it supplies all the muscles of the tongue, extrinsic and intrinsic muscles of the tongue, except a muscle called the palatoglossus. And when you ask the patient to, if you want to test the 12th cranial nerve, what do? You ask the patient to stick out their tongue. When the patient sticks out their tongue, in this instance, the tongue will deviate to the side of the problem. And let me explain.
Open it. Just open it there. Take one for me. My head is worrying me.
Now, if the patient is having a weakness on the right side of the tongue, and the patient sticks out the tongue, that right side muscles will be weak. So it will not be able to protrude or project the tongue out. So what will happen is that the strong muscles on the left side would overshoot, and then the tongue would bend over to the other side because the other side is weak. I hope you get it. So for hypoglossal nerve or the 12th cranial nerve, if you ask the patient to stick out the tongue and the tongue goes wherever the tongue goes, that is where it has the weakness. Okay, so all these 12 cranial nerves, when we were in school, it was challenging to remember which is which. So which cranial nerve is cranial nerve 1? Which one is 2? Which one is 12? Yes. Yes. Okay. So we came up with a way, and there's a mnemonic that will help you to remember. And this mnemonic is we have a mnemonic we used to say it like this. To touch and feel a girl's vagina, then touch heaven. So, me say. So this is how. So you can write it down. So write it down. To touch and feel a girl's vagina. So the first O is the olfactory nerve. The second O is the optic nerve. The third O is the oculomotor nerve. Then to touch, two doesn't stand for anything. So touch is touch and feel. So the A is the abducent nerve. The T is the trigeminal nerve. The first T, the 2, is a trochlear nerve. Okay, so the 2 stands for something. So the trochlear nerve, the other. So I remember the acronym, but it's difficult to remember what it says. But I'm sure I'll still remember it. So 2. 2 is a trochlear. Touch is trigeminal. That's a fifth, and doesn't stand for anything. Feel is facial nerve. The air doesn't stand for anything. So girls. So the girls is glossopharyngeal. Then the V vagina is for vestibulocochlear. Then Sach heaven. So the Sach is spinal.
Madam, please, you said the vagina is what?
Vestibulocochlear nerve. Then the Sach heaven is for spinal accessory nerve, and the heaven, the H is for hypoglossal. I hope it's clear.
Come and take it.
You understand?
Yes, it's all right.
I understand.
If there are any questions, that's just mnemonic to help you remember. The 12 cranial nerve. To touch and feel a girl's vagina, such heaven. Yeah.
Oh, is such a heaven or is such heaven?
No, such heaven.
Nice.
Such heaven. How come the vagina is touch heaven?
It's like a mnemonic, and it really helps you remember in those days in school. So you can.
Okay, madam. Thank you.
Maybe So please, if you have questions.
I have a question.
Yes. Yes.
Madam, with the optic nerve as touch, does the room, the like whether the room needs to be a bit dark because of the people already will be reactive to the lighting of the room. So must you always make sure that the room is a bit darker before you use the pen touch, or it doesn't really matter?
It does. That helps you to see better the reaction. So it helps you to see better. So it's better if it's darker.
Okay, madam.
Yeah.
Madam, what of those people with alukumi? What is the dysfunction with the eyes?
Strabismus.
That is strabismus.
Strabismus.
And it's with the oculomotor nerve.
Okay.
The nerve that helps with movement of the extraocular muscles of the eye.
Okay. Thank you.
Any other questions?
Please, I have a question.
Yes.
When ask the question.
well, when there's an abnormality with the nerve, can it be corrected?
It depends on what's causing it. So let me give an example. If there's a brain tumor, right, and the brain tumor is pressing on the nerve and causing compression, if we go and operate and take out the brain tumor, then the nerve will be okay. But if there's an accident, head injury, where the fracture of the skull bone, you saw the diagram of the
section of the head.
You saw where the nerves come from.
Yeah.
So if there's a skull fracture and the nerve is cut by, maybe there's a fracture which causes a truncation of the nerve, then that one, nothing can be done.
Can they patch it?
Well, that's not that kind of surgery is not available here. Nerve grafting. No.
Well, could it be the reason why sometimes when somebody's involved in an accident, say maybe if it's a man, he can never have an erection?
That has nothing to do with the cranial nerves.
No, not the cranial per se, but is it as a result of a nerve being damaged?
It's possible. It's possible. It's possible that can cause nerve damage.
Okay.
Yeah.
So my next question: can listening of loud sounds for a long time affect the vestibular nerve?
Yes.
Sounds.
Yes.
Okay. Okay. Thanks.
Any more questions? Auntie Mary, I come to ask. You ask, I know.
I don't have a question today.
You don't have a question today?
Yes, please.
Okay. Nick, do you have a question?
No, I'm okay.
Madam, it seems everybody's took apart from Elijah.
I hope you understand.
Yeah.
Yes, madam.
Who is sitting in a trotro? Who is iPhone?
Can we end?
Yes.
Someone
Yes.
just came to Stephen. You came to end the lecture.
And it's not easy. Wahala out there, dear. It not be easy, cry.
Don't worry, small.
Once more, we'll get there.
Where these people will start the right exams and asking for school fees. Our head don't die.
Well, I haven't finished teaching, so I don't know how I can set questions.
Don't test to assignment. Assignment is okay. Okay, give us assignment. Advocating for assignment. That's what Tech is saying. So you just consider us. Consider our age.
You read your notes and let's see.
Okay.
I'm hoping that we can finish this week because I'm thinking of traveling